So we're doing a number of things as an employer, and we're doing the yoga in the big house for sure. But we hired a resource coach, a success coach, to work with employees. And she's a social worker. If you don't have a ride to work or you're having difficulty with childcare, she can help. You might have a family member that's eligible for SNAP benefits, but the process of applying is difficult and challenging. She can help with that. She just started a couple weeks ago, but we modeled this based on what another employer has used, and thinking about our own at the University of Michigan Poverty Solutions initiative, thinking about resource coaches, success coaches. We are doing a number of things around food and food security. Some of the staff at one of the clinics felt pretty frustrated, and I'm looking over at Mercy, my colleague from Michigan, in Ypsilanti at Maggie's Marketplace. One of the physicians at this clinic, recognized that we were telling people to go eat healthy and eat this kind of diet, but they were having difficulty accessing food, so they partnered with one of the local organizations that does a lot of work in food security and food banks, and they have a lovely, they call it Maggie's Marketplace, name for the medical director who championed it. And at the same time, they realized that a lot of their employees had food security issues too. So some of the things that M Healthy, our employee well-being services, has done is make sure that we bring produce there. We're doing produce drop-offs, and we're also trying to bring resources there. The best example of this I have is the tobacco consult service, which there are evidence-based ways to decrease your dependence on cigarettes or other forms of nicotine. And every day I drive in and I see, we're smoke-free, and the health system is actually tobacco-free, but you have people who are smoking in this designated area, and they're often wearing matching uniforms. They have big block M's on them. And, if they don't know that the resource is there or they can't get to it, then shame on us. If that they just aren't interested, then that's okay. I think we can continue to try to address these issues. I think we can address them in other touch points like occupational health, at health fairs. So we're trying to think more actively, not just saying, hey, we have this.